So I'm pinch hitting this morning for Dr. Lisa Renzi Hammond from the CARE Center at the University of Georgia. CARE stands for Cognitive Aging Research and Education. We're part of the School of Public Health. And I'm a clinical neuropsychologist, and we're here. I've got Dr. Janae Beer with us and Dr. Christy Proctor. And we're going to present about how to keep yourself strong and healthy in farming. We're going to talk about issues of strength and health, cognitive health, emotional health and caregiving, and emotional health for yourselves. That's what we're going to talk about. So here we are. So this is the CARE Center, and this is us at two recent events, and I think I wasn't at the one on the left, but that's Dr. Renzi Hammond in the center there. She had a family emergency and had to head home. That's all of us. That's Janae and Chrissy, Lisa, and that's Noah, one of our doctoral students who couldn't be here today, and Spencer, who is here today. I just saw him walking in the back of the room. And we're at Savannah at the Georgia Fruit and Nut Growers meeting, Fruit and Vegetable Growers meeting, and then in Tifton at the Don invited us down in Tifton at the Georgia Peanut Commission Conference, and we were promoting our mission on cognitive health and well-being and collecting some information from you all. And then what we do for a living is we go out to communities all over the state. University of Georgia is the land grant institution for the state of Georgia. We have a presence in every one of our 159 counties. Well, we've been in about 100 of the 159 counties, but the university has a presence in all 159. And so we go out into communities and we talk about healthy brain aging to try to empower people to live a healthy and positive life. And you can see, so we'll be in community centers, churches, health fairs, playing with goats, all sorts of things that we do. Keep people well and healthy. Oops. All right. There we go. Okay. So we're all getting older. Getting older is something that we all do. We're all doing it right now, right? So you're getting older by the moment, unfortunately. But if we look at the U.S. Census Bureau, and just to orient you to this graph, okay, this is percent. This would be zero, no change over time in population growth from 2020 to 2025. This would be increase, this would be a decrease. And then you look at ages, this total population, folks under 18, 18 to 24, 24 to 25 to 44, 45 to 64, and 65 and older. And what you see is the South here in orange is growing overall in all age categories compared to other areas of the country, even here, just a little bit. But all parts of the country are growing in the 65-year and older category, our population. Especially the South is still beating there in the older category. So we're getting older, particularly in the South. That's the message of that slide. And so what are we all afraid of as we get older? And the AARP surveys have shown that according to their data, folks are mostly worried about financial security as they age. They're worried about disease, particularly cancer, and they're worried about dementia. Right? That's one of the big things that folks are worried about. So what we're going to do is let's focus on dementia. So that's what we do. I mentioned that my training is a clinical neuropsychologist. What the heck is that? That's a clinical psychologist who focuses on brain health. Okay. So this is an area that's the area of brain health that I've focused on. So I sort of live in this area of dementia in terms of my clinical work with patients. So let's move forward with the slides. Oops, I want to advance. There we go, okay. So let's talk about Georgia a little bit, since that's where we're from. So we think about Georgia, and we have this acronym that I'm going to use on these slides, ADRD, for Alzheimer's disease and related dementias, okay? So let's get one thing clear. Dementia is not a disease. Dementia, think about that as a state of affairs. And the state of affairs of dementia, I like to think about it as you have cognitive impairment. Cognitive is just a fancy word for thinking abilities, right? You have problems with your memory, maybe you have problems with language and other thinking abilities like problem solving that make it so that you can't really function independently. You need help. That's dementia. You have cognitive problems that interfere with your ability to live independently. And then the question is why? What's the disease or the condition that's causing that dementia? Alzheimer's disease is by far the most common cause, but not the only one. About 60 to 80% of all causes of dementia are caused by Alzheimer's disease, although Alzheimer's disease sometimes comes along with some other causes of dementia. But there's vascular dementia, dementia from Parkinson's disease, dementia from Lewy bodies, there's a whole bunch of reasons. So we use this blanket term, Alzheimer's disease and related dementias. Georgia has 159 counties, 120 of them are deemed rural. We are ranked 7th nationally for the prevalence of Alzheimer's disease and related disorders. One of our counties is in the top 10 of all counties in the country for its rate of Alzheimer's disease. That's Dougherty County in southwest Georgia, excuse me. And we're first in the United States for the average number of hours, estimated hours, spent caregiving. And this is information from the Alzheimer's Association. We're ranked about 38th, depending on which survey you look at, about 38th. Some have us up to 50th in terms of how well we do in Georgia caring for older adults. So not terribly good. We could do better. We are spending about $33,000 per capita in Medicare expenses in 2025, caring for folks with Alzheimer's disease and related dementias. About $1.8 billion in cost to Georgia's Medicaid program. 157 more ER visits. I think this is data since 2020, and readmission rates for Alzheimer's disease and related disorders. And it's estimated that in fiscal year 2026, Georgians will provide about 789 million hours of care for patients with Alzheimer's disease. And a lot of that's informal care. Family members taking care of family members with an estimated value of about $14.3 billion. That's a lot. And about 65%, that's about two-thirds, a little over two-thirds of Georgia's caregivers have chronic health conditions of their own. And that could be chronic hypertension, high blood pressure, diabetes, what have you. But about a third of them have depression. And much of that depression is related to the stress of caregiving. And it's estimated that to meet the demand, because of the aging population, that slide I showed you a little bit before, that we're getting older, especially in the South, that to meet the demand by 2050, we're going to need a 180% increase in workforce of healthcare workers to care for this population. So it's a big challenge that we have. And Janae can stop me and interrupt me if I've got any of that wrong. Okay, so there's a dementia belt in the United States. If you look at this map, the darker colors show you where the concentration of dementia is, and look where it is. It's right there in the South, right? That's where, I mean, there's certainly other places in the country where there's high rates of dementia, but it's sort of concentrated there in the South. And particularly in rural communities, they have the highest risk. But some of that risk, a lot of that risk for dementia is modifiable, right? You might not be able to stop it, but you might be able to modify it enough so that you can forestall it, push your likelihood of getting it down the road a piece, right? Maybe push it down the road so far that something else gets you first, okay? So you don't develop dementia. And so the thing is that these rural communities are the least studied. When we do trials in the Alzheimer's world of new treatments for Alzheimer's disease, it's about 2% of people that are from rural communities, because those big academic medical centers that study those new drugs are in big cities, okay? So they don't pull from these rural communities. So let's look at some of our neighboring states. Alabama, 6th in the US for hours spent caregiving. So kind of like Georgia. 31% of caregivers are estimated to have depression, right? 6th highest death rate in the United States due to Alzheimer's disease, right? Or complications from Alzheimer's disease. We look at the next state, Mississippi. Mississippi has experienced a 257% increase in death from Alzheimer's disease-related conditions from 2020 to 2024. Right? Because of this aging thing, because the population is getting older. 34% with depression. So we're hovering around a third of caregivers with depression across these states. First, that 257% increase puts Mississippi at first highest death rate in the United States for cases related to Alzheimer's disease. South Carolina, 60% of caregivers have chronic disease, 31%, again, about a third of those with depression. 168% increase in Alzheimer's disease deaths from 20 to 2024. Okay. Florida, about the same thing. $30 billion in unpaid care. Right? Family members taking care of family members. And that's sometimes those family members having to take themselves out of the workforce to care for a loved one. So now that you know where things stand, what do you need to know? So Alzheimer's disease or dementia of any type is not a normal part of aging. Right? It's different, and we can detect that difference. Okay, so what is Alzheimer's disease? Alzheimer's disease is a disease of the brain. As you know, there's 2 proteins that we all need and have and need and use all the time. And for whatever reason they go wrong in Alzheimer's disease, I'm not going to get into the neurobiology of that for you. They go wrong in Alzheimer's disease, instead of becoming helpful, become harmful and gradually cause your brain to decline. So if you look here on these left panels, this is a pathology specimen. So here's a brain, here's the front of the brain, back of the brain. This little area is called the cerebellum, okay? And the brain kind of looks like a boxing glove. It's got like a thumb here, right? Kind of looks like that. All right, this is a nice normal brain, all folded up with really tight folds here, tight spaces. This is all good. And here's the brain, a slice of that brain. Now the brain, to orient you to where that is, imagine the brain sliced this way and then this way. So you get kind of a quarter of the brain sliced here. And what you see is these folds here, there are the folds. And you've got this fluid-filled space inside the brain that's normal, this really thin area that's filled with fluid in the brain. That's what it ought to look like. And I'm not going to try to orient you through here because this is a really deep structure. You can't see this, but it's really deep in the brain. This little area here that's really important in making a neurotransmitter in the brain so that neurons can talk to each other. It's a chemical area here. Alzheimer's disease, notice how much bigger the spaces are here. Look at the folds have more room in them than they do in the normal brain. And you can see that in this same quarter section, right? There's much more space. This little slit here that's fluid-filled has gotten much bigger. Why has it gotten much bigger? It's gotten much bigger because the brain has atrophied. And when the brain loses tissue, water comes and takes its place, okay? So you notice that there's no holes here, there's little holes here. These are vascular changes in the brain because of the Alzheimer's disease. And you notice how nice this section looks here, and there's much more space here. This is all Alzheimer's disease declining and causing those memory loss and the loss in language function, the loss in problem-solving skills, all because of what's going on in the brain. But it turns out that it's estimated that about 45% of Alzheimer's disease, again, I'm focusing on Alzheimer's disease because when we think about dementia as an overall thing, and there's lots of things that can cause dementia, but Alzheimer's disease causes about 60 to 80% of all cases of dementia. So it's a lot. So about 45% of that can be delayed or prevented. So let's talk about that a little bit. So here are some of the things. I'm going to walk you right to left on this slide. So how do you prevent and delay dementia? Well, you reduce vascular damage and risk. You reduce some of the pathology. You reduce stress and inflammation. And you build cognitive reserves. That means keeping your brain healthy and active. All right? So let's talk about vascular damage. How do you reduce that? So you reduce diabetes, you manage your cholesterol, You'll keep your blood pressure under control. You stop smoking, reduce obesity, reduce air pollution, right? We don't think about that a lot in the United States, but in some countries, air pollution is a really big deal and can cause inflammation because it gets in your lungs and those particulates get into your bloodstream, get into your brain, and cause an inflammatory problem in your brain that can lead and promote Alzheimer's disease. And you prevent repeated head injuries, okay? These are things that can cause vascular damage. How do you prevent the disease itself? And how do you reduce stress and inflammation? Because inflammation in the brain promotes the cascade of Alzheimer's disease. Well, you prevent depression. Remember those slides showing about 1/3 of all caregivers have depression, much of that related to the stress of caregiving. So Dr. Beer is going to talk about that, and Dr. Proctor is going to talk about that. So treat depression, keep yourself physically active. One of the best antidotes for stress and depression is physical activity. Keep yourself active. You guys are farmers, you're active all the time. And minimize alcohol intake. Don't do too much of that. All of that can have great effects on reducing stress and inflammation and help to slow the cascade of pathology that happens in Alzheimer's disease. And how do you build brain reserve? Well, you can't make your brain bigger, but what you can do is keep the connections that in your brain stronger, all right? And keep that memory system working strongly and the language system and the problem-solving system working strongly. And how do you do that? You do that by keeping yourself educated, doing new things, learning new things all the time, keeping yourself cognitively active, keeping yourself socially active, preventing and addressing hearing loss. We're increasingly recognizing that untreated hearing loss can contribute to dementia, particularly Alzheimer's disease. We don't really quite understand the physiological link there, but there's a link there for sure. And so nutrition is a big factor in all that. What you eat has a lot to do with your blood pressure, your cholesterol, your diabetes level. It doesn't have a lot to do with head injury and air pollution, but it has a lot to do with about your vascular status. It has a lot to do with depression and physical activity. Don't eat too much because otherwise you can't be physically active, right? Watch what you do for your alcohol. And your diet, has to do with can help keep you, if you're intellectually active, you have to have the right foods to stay intellectually active. Your brain needs glucose to think, but not too much. So all of that can help you. The Lancet Commission has, every 2 or 3 years, they produce Lancet Commission, big British journal, has a commission. It's a worldwide commission that looks at Alzheimer's disease. And every couple of years, they produce an article on this. And they're the ones that estimate about 45% reduction in risk. And this takes you through early life here, things that you can do in early life, midlife, and into late life to help you reduce your risk of dementia. So having good education, these things are things that contribute risk. The less education contributes risk. Get a good education early in life, correct your hearing impairment, all the things that are on the left side of the screen are here. So reduce your smoking risk and all of that. And then in later life, avoid social isolation, watch out for air pollution, watch out for vision impairment. Hearing is in here someplace. All of those things can help you reduce your risk.